SpectraCell was started in 1993, and it was based then, as it is now, on a unique intracellular functional set of tests for essential micronutrients. And although we've expanded our menu in the years since then with other complementary and interesting technologies, that intracellular functional micronutrient test has remained at the core of who we are.
What we do in the micronutrient test is we isolate the patient's lymphocytes from the blood specimen that was received at the laboratory. We will dilute it to an appropriate concentration of cells per milliliter, and then we will inoculate microtiter plates that have 96 wells in them, each containing formulations of the patented media that we use here at SpectraCell. What happens is in certain wells it will be deficient in vitamin B1 or vitamin B6. We'll stimulate that lymphocyte population to grow with a mitogen, in this case PHA, phytohemagglutinin. This will promote the proliferation of the T lymphocytes that have been added to the microtiter plate. We measure the growth of the cell by the incorporation of radioactive thymidine into the DNA, and that measures the proliferative response of that cell in the absence of a specific micronutrient. This is an actual determination of the functionality of that specific nutrient within the cell. Much different than what's outside the cell, which is how we've traditionally tested patients in looking at serum measurements, for example, of folic acid. Folic acid has no purpose outside the cell, but inside the cell is where it's used, so we're actually measuring the function. And frankly, we're the only laboratory in the world that can perform that.
By measuring each patient's unique individual cellular function, our test is able to guide the doctor in preventing diseases, slowing cellular dysfunction, and so that's really at the core of our approach today, which is wellness, prevention, aging management. All that is built around correcting targeted, precisely defined nutritional deficiencies in a patient.
One of the very important things that I think we really need to look at for our patients is their deficiencies in their nutrients. And the best test for that is the micronutrient analysis by SpectraCell Laboratories. I have had about 8 years of experience with this lab, and I find that it is by far the best way to analyze what deficiencies each individual has in regards to their vitamins, minerals, and antioxidants.
Our micronutrient testing is at the core of personalized medicine, which is the whole new paradigm, we believe, in the healthcare field. And we've developed other interesting tests in the area of genetic predisposition, lipoprotein measurements, telomere testing, and a variety of biomarkers that give the physician a complete, well-rounded, in-depth picture of the patient's health, all centered around micronutrients at the core of that profile.
The methodology that's used for the performance of the micronutrient testing is really a measurement of cell-mediated immune function. And frankly, when I look at a patient report, the most important thing I see is how well did the patient's cells respond to the mitogenic challenge. We want to optimize the immune system performance so that we can keep patients healthy and well. And we call that test, the proliferative response of the lymphocyte, the immunodex. And to me, as I say, I think it's the most important test on the whole report.
As a director of clinical research and education for SpectraCell, I know a lot of physicians are concerned about the side effects of some of the medications that they're prescribing. And I think it's very important that physicians realize that there's answers out there from a nutritional intervention. Physicians are also seeing this as more specific testing in what they've been taught in their schooling, whether it's been serum testing and the micronutrient test, or they've done the general lipid panel and now they're doing the lipoprotein particle profile, where they're getting a much more detailed evaluation of the patient. And people are seeking those, and the public really wants answers on what is the underlying cause of some of their conditions.
SpectraCell partners with physicians from multiple levels. We have a team that is in the field that works with the physician one-on-one and their staff. to help interpret and introduce our testing into their local environment. We have a team at the corporate office who is there to answer any questions for the patients and physicians as well. We have a consultative team that works closely with the physicians as well to help deliver the message of what the physician has found in their test results. We understand that it's all about communication. So we use our report as a communication tool to be able to help the physician not only understand our testing, but help explain our testing to the patient. Because from that point on, the patient then has to take that report home and interpret it into his everyday life, transitioning that to his family, and it may cause a change in their lifestyle and how they eat and how they approach health in their home environment. But it all starts with how do we educate the patient to be able to do that.